Dave Scott, Hub Media, back with Braden from Advantage Athletic Therapy on the Queensway in Simcoe. And Bud, I want to talk a little bit about injuries, long-term injuries a little bit. My hockey career, my running career, lots of broken ankles, separated shoulders. How about you? Did you have anything like that?
Definitely. I broke my collarbone twice, repetitive strained ankles, and still dealing with some of those issues to this day.
And that's why I figured you'd probably be in the same boat as me. And that's what I want to talk about is the long-term effect of injuries by not addressing them when they occur. I mean, I think you and I are both the type of guys like, yeah, I'm okay, coach, put me back in, and struggle through it. And then you can't walk for 3 or 4 days and, things get worse before they get better. And as you age, those things, you'll find those things start to catch up with you. Trust me. But what I wanted to talk about was just people not treating them in that moment because sometimes our egos get in the way. I don't know what it is. We feel like we're invincible, but talk a little bit about that and what people should be doing.
For sure. And yeah, it happens everywhere. Like I think Paige talked on it last time when you guys spoke about getting into yard work and maybe a repetitive injury there, or kids in the local area playing high school sports to professional athletes. And there's a lot of times where we're always kind of geared to push through the injury. Oh, just suck it up and keep going. But we don't always take into consideration long-term effects, right? And sometimes it could be a long-term effect that like me dealing with my ankle injury, but it can also be somebody starting off the season, they tweak a hamstring and then, they play through it. Then all of a sudden it's a bigger injury and now they're out for months, right? So those are the things that we kind of need to take into consideration and really kind of look at it as like a whole approach as opposed to being just in the moment and fighting through that pain for that second.
And it can, like we talked about, it can lead to complications. So it's important that they get in early, get it addressed, and figure out, what needs to be done to correct it. The other part, you talked earlier off air, and I thought it was great advice. Listen to yourself, to your body when those injuries occur. Don't feel the pressure around you just to perform. Make sure that you are safe, correct?
Right. And I find that with young athletes especially, they're hearing it from their coaches, whether it be at club or their high school coaches, maybe that's parents, their own other parents or teammates pushing them through. And it's easy to have that little peer pressure where you feel obligated to push through that pain, but nobody knows what you're really feeling except for you. So if there's times where your body's telling you enough is enough, then it's crucial to listen to your body, go in, get treatment, get better, and then return. We don't want to ever come back too early because that's where those injuries, they get a lot worse, right?
Last question. So, like I said, an advanced stage fellow like myself with old injuries and scar tissue, is there anything you guys can do for that?
For sure. Everybody's welcome into the clinic, and we help with people from all ages. I've had patients from 4 to 84, and those old injuries, they, like you said, they create changes, and sometimes it's compensations, and then now that ankle injury, you're starting to feel it in the hip. So those are all things that are connected, and certainly we can go in and take a look back into your history and kind of help out with things that are going on now and maybe associated with those old injuries.
Perfect. And folks, if you do get an injury, sports related, gardening injury, anything, make sure you go see these guys. They know what they're doing. That's for sure. Thanks for doing this today. Have a great week.
No problem. Thank you.